Hi there, Eric Bakker, naturopath from New Zealand. Thanks for coming back. We're talking about cutaneous candida. We're going to look at treatment. What's the most effective treatment to treat a skin-based yeast infection? Well, as I say, in my book and my videos, it's not just about doing one thing, it's about doing a whole bunch of stuff. So when it comes to treatment, I want you to look at the lifestyle, I want you to look at the diet, I want you to look at some supplementation, I want you to look at some skin kind of products to use. So this is all going to work towards your favor to get rid of this problem. I had very bad yeast infection in my 20s, and I had it also on my skin. But I can remember back in those days, I'd spend time at the beach. I was surfing quite a bit, when I was young. So if you have a look, if you have got a skin problem, have a careful look at your lifestyle and make some countermeasures to stop from doing the same thing. The definition of insanity? Doing the same stuff, expecting a different outcome. So you've got to do things differently. If you've got a skin-based yeast infection, ask yourself, well, what am I doing? What can I be doing differently? Do I need more sunlight exposure? Do I need drier skin? Do I need to change my diet? Do I need to change where I'm living? Do I need to change my hobbies or interests? So when I started noticing I had a bad skin problem, the way for me to get on top of it was to keep my skin a lot drier, because I had little white patches all over my skin. And once I stopped spending so much time in the water and spent a little bit, more time in the sun and dry the skin out, the skin condition got a lot better. So as I mentioned previously in the other video, if you've got a yeast infection involving the toenails or between the toes, you need to keep the foot drier and involve more sunlight. If you've got a yeast infection of the ears, you could have a lot of itching around here. It's not that uncommon. I see this symptom a lot in people. Try not to wear any earplugs or headphones. Okay? Try and keep the ear clean and also keep hair away from around the ear. And more importantly, include dietary changes along with this. So have a look at the Candida Crusher dietary program and follow the MEVI diet: meat, eggs, vegetables, and some yogurt. Try and keep away from refined foods, from sweet foods, from sodas, from candy, all these kinds of things. So stop feeding the yeast infection internally. What you eat here internally is going to influence the skin greatly. So if you've got bad itching all over the body, you could have psoriasis, for example. So some people confuse psoriasis with a skin yeast infection. In fact, research has shown that nearly 70% of psoriasis patients have got a candida problem. So check out the diet, which I've spoken a lot about. I've done many videos on positive lifestyle changes. And also have a think about maybe some skin-based products like tea tree oil, for example. Tea tree oil works quite well. You can even get a tea tree oil soap and wash the whole body with that for the skin problem. Around the creases and folds and the groin, this is going to help you considerably. Essential oils may be another alternative that you want to think about. And check out the Candida line of dietary supplements for internal use: Candida Remove, Candida Rebuild, and Candida Restore. They work beautifully in conjunction with a skin-based treatment program to help eradicate cutaneous candida. So I hope that gives you a bit of information on skin-based yeast infection. You can nail this problem. You just need to really understand, what it is, the causes, and then what to do on how to counter those causes. Thanks for tuning in.